Hello, everyone, and welcome to today's presentation on e-prescribing. We are excited to have everyone here and joining us today on this very timely topic. I know there's been a lot of interest around e-prescribing in the state of Florida and what capabilities there are and what can be done. And we have three very knowledgeable panelists with us today that are going to share their insights and lots of valuable information that I know you all will be able to use. My name is Pamela King, and I work here at the Agency for Healthcare Administration and share information about the agency's health IT initiatives here in the state. We have several initiatives around health IT, of course, electronic electronic health record Medicaid incentive program. We do some promotion of telehealth, and we're the governance for the Florida Health Information Exchange. But we also promote e-prescribing in the state of Florida, and we've been working on that project for many years. So we're really excited to kind of highlight what is going on in this area in Florida. We do, as part of our efforts with e-prescribing, have an actual dashboard on one of our websites. It's FHIN.net. We lovingly call it FIN. So at FIN.net, you can take a look at our metrics related to e-prescribing in the state of Florida. We have seen a steady growth in e-prescribing since the inception of the initiative back in 2007. And so we want to have of course, we always want to continue to see improvement in areas that we believe will help in patient care. With that said, I do want to introduce our panelists for today. In alphabetical order, we have Michael Jackson. Michael Jackson has been a great friend to the agency for many years. He's actually served on several panels and councils for us over the years. He is a licensed pharmacist in both Florida and Alabama. He obviously started practicing pharmacy at birth, as you could tell from his photo, and yes, he does look just like that. He's been practicing for over 37 years. He is, I know you can read his bio on your screen, so I won't read it word for word, but as I said, he is a great friend to the agency. He is Executive Vice President and CEO of the Florida Pharmacy Association, as well as many other efforts that he undertakes. And so we're really thrilled to have Mr. Jackson as part of our panel. Secondly, we have Dr. Vashaun Williams. Dr. Williams is a certified psychiatrist for children, adolescents, and adults, and works in the Tampa Bay area as a leading mental health provider. He works with Empower doing telehealth services, and so that's a really wonderful concept. As I mentioned earlier, telehealth is one of the areas that we like to promote, and so really like to get insights from him on how telehealth works with e-prescribing. So excited to talk to him. And being a Tallahassean myself, Dr. Williams was born in Tallahassee, Florida, so I appreciate that, Dr. Williams, and actually got his bachelor's degree from Florida A&M University, and go Rattlers, and his medical degree at Morehouse, and probably most important in his life is he's been married to his wonderful wife for 21 years and has two beautiful children, Alexis and Vashaun Jr. So thank you so much, Dr. Williams, for joining us.
Thank you.
Last but not least, we have Ken Whittemore. Ken Whittemore is the Vice President of Professional and Regulatory Affairs for Surescripts, who is a health information network vendor, working a lot with e-prescribing and sharing of prescription data between electronic health systems. And Ken actually started as a pharmacist, as an independent pharmacist in Maryland, and I believe he still has his license in Maryland. So Dr. Williams is surrounded by pharmacists today. So thank you so much.
Good morning.
Good morning. Thank you for joining us. With all that said, we are so grateful to have such a wonderful, knowledgeable panel of individuals with us today. So I'm going to just jump in and I'm going to ask you some questions, but I'm going to also open up to those in the audience. If you have a question you would like to ask the panelists as we're going, please go ahead and type in your questions in the question panel that you'll see the term questions. Go ahead and type in your questions as we're going along, and we will add your questions in and go ahead and ask the panelists those questions as we go forward and learn more about e-prescribing in the state of Florida. So, Ken, since I ended the introductions with you, I'm going to start the questions with you. As an e-prescribing vendor, can you give us a little bit of information about the current state of e-prescribing adoption in both in the United States and in Florida?
Sure, I'll be happy to. And actually, just to level set, we consider ourselves to be a health information network rather than vendor. Just a slight difference in terminology there. So let's start out on the pharmacy side, because the pharmacies are a little bit farther along in terms of e-prescribing than the prescriber community, and there's some reasons for that I'm sure we'll get into during today's call. But if you look at the national numbers, about 97% of ambulatory pharmacies are capable of receiving electronic prescriptions. Actually 97.1%. Florida measures up quite nicely at 97.3%, so just a smidge above the national average there. So kudos to Michael's constituents in the Pharmacy Association. They've done what they need to do in order to participate in this type of electronic communications. So that's e-prescribing in general, but there's also some additional things that pharmacies and physician systems need to do in order to become enabled for electronic prescribing of controlled substances, which is also important. As it stands now, about 92% of the pharmacies nationally are able to receive electronic prescriptions for controlled substances, or EPCSs, as we like to call them. And Florida is just a little bit behind that at 89.7%. Not very far behind, but overall, very significantly along the way of being able to participate in these electronic transactions. On the prescriber side, things are a little bit more complex, and that probably has to do with the complexity of getting enabled for not just e-prescribing, but specifically electronic prescribing of controlled substances. We have about a total universe of 78,000 prescribers identified in Florida, and currently about 48,000 of them, or about 62%, are actively e-prescribing. The percentage, though, that are able to e-prescribe controlled substances, however, is much, much smaller at just shy of about 6,800, which is about 8.7% of prescribers. And the reasons behind that are that when the Drug Enforcement Administration published its rule in 2010, 8 years ago, it's kind of hard to believe it's been that long, to allow electronic prescribing for controlled substances, they placed some pretty rigorous and strict requirements on the electronic health record systems that prescribers use in order to allow their end users to e-prescribe controlled substances. And it's taken them more effort and time to do the development and to get that additional functionality rolled out to prescribers. And there are also some additional things that prescribers need to do. They need to go through an identity proofing process and prove who they are and that they have the necessary credentials to be able to e-prescribe controlled substances. And once they've done that, they're issued a two-factor authentication credential, which they use to digitally sign electronic prescriptions for controlled substances. And all of that takes time. There's expense involved. And these particular items, although there were things that the pharmacy systems had to do, there was a heavier lift on the prescriber side, and that's why we attribute the smaller number of prescribers that are able to transmit controlled substance e-prescriptions. Specifically in terms of how Florida compares nationally, as I said a minute ago, 62% of prescribers in the state are e-prescribers. That compares with about 70% nationally, so just a little bit behind there. But in terms of the ability for Florida prescribers to prescribe controlled substances electronically, they lag significantly behind at 8.7%, whereas the national average is about 24%. I will add one thing, though, and this is going to sound a little bit odd, but there is so much e-prescribing going on in the state of New York that one state is actually skewing the national average. So probably in fairness, what we ought to be doing when we're looking at is kind of factor New York out. Finally, and just give you a sense, in the month of February, there was just shy of 9 million electronic prescriptions transmitted in Florida, and about 250,000 of those were EPCS transactions. So that's about 3%. Normally, about 13% of prescriptions are controlled substances. So you would expect that 3% to be much higher in an ideal world. So that's kind of the way the numbers shake out at this point.
Okay, thank you so much. And why, this is just a side question, but why is New York so high, the e-prescribing of controlled substances so high in New York?
I should have, I guess I should have gone into a little more detail there.
Okay.
Several years back, New York passed a law known as iStop. One of the requirements was iStop, was that it was going to mandate e-prescribing across the board, and it did. And without going on into all the details, that mandate took effect almost exactly 2 years ago. It was March 27th of 2016. And that mandate has had a very dramatic effect on the uptake and the adoption of e-prescribing, both in general and for controlled substances. Just to give you a sense, I mentioned that the national average for active e-prescribers is about 70% nationally. It's 90% in New York. And in terms of the number of prescribers that are capable of transmitting controlled substances, again, I mentioned about 24% nationally, it's 75% in New York. So, and they've got statistics, they've got a lot of prescribers in the state. 1 out of 12 prescribers in our network is in New York. So that'll kind of give you a sense of why they're skewing things.
Okay. And Dr. Williams, Mr. Whittemore mentioned what he believes are some of the barriers to prescribers, so physicians in prescribing, in particular e-prescribing, in particular controlled substances, as well as e-prescribing in general, some of the rigorous things that need to be done. And I know that you e-prescribe, and you e-prescribe, I believe, controlled substances as well. So are those some of the things that you're hearing from providers as to why they're not doing e-prescribing, and what has your experience been with e-prescribing?
Well, thanks for having me as a part of the panel discussion, first of all. With regards to what are some of the reasons behind, I think, why we're lagging, I think first and foremost, anytime there's, change, especially for those of us that are just regimented in doing something a certain way for so long, there's going to be a little bit of hesitancy associated with it there. And I think e-prescribing period, has been an adjustment for us since we've been just a lot of times regulated to doing things by paper and pencil for so long a period of time. Oftentimes, I think that agencies, practices versus individual types of practices. Oftentimes, people may have their own specifications for the way they like to do certain things, and so that autonomy sometimes and difference in that sometimes cause people, I think, to stay within a realm of the way they like to operate for certain things. I can say that even within agencies I've worked with before, when there has been a change or a transition for a plan to move over to e-prescribing, it's just sort of been a gradual process, and people who are, I guess, newer to medicine oftentimes are a bit more sort of willing and flexible to do it. Sometimes I think the technology and dealing with the technology can be intimidating for some people who haven't been accustomed to doing that overall. So just e-prescribing in general, I think, is just sort of a change in philosophy that has to happen. It has to happen gradually over time and to move, away from what we've always been comfortable doing. I think definitely familiarity breeds comfort. So the more familiar with it, the more comfortable people will be in doing that. I think that, yes, sometimes the lengthy process of getting, I guess, costs that could be associated with going through the extensive process of gaining access to electronic prescribing, in particular of controlled substances, sometimes may be a deterrent for others to want to do that as well. But for the most part, in my experience, it has just been the lack of just familiarity with it and comfort with it, and not really doing it as much. So, and oftentimes, if it has not been mandated or has not been required by a particular practice or a particular system they're working in, individuals may not be as inclined to move over to doing that. In my experience, I've, I guess, been e-prescribing and using some type of electronic version of prescribing, since residency in medical school, since training. So in doing that, moving over to that, it's been sort of natural for me. So I definitely think that as, more providers are coming out, they're going to be more accustomed to it, and getting others who have not been doing that as much to transition over to it. That's the challenge and the change. As far as electronic prescribing of controlled substances, I've had an opportunity to work with an agency, Empower, who has been definitely a leading provider in the state of Florida. It's a telehealth. Primarily, we provide services in a telehealth platform, which is one of the elements of Empower and the one I work with specifically. But what it's done, it's been able to bridge the gap and been able to bring services to a lot of areas where they don't have providers. And so being able to address that very important paucity of providers and that lack of providers that exists for my particular specialty, Empower's made a major role and a major dent in trying to do that. In order to do that, and me practicing psychiatry and child psychiatry in particular, requires a certain percentage of my practice deals with prescribing some controlled substances, stimulants like for ADHD and things of that nature. So in doing that, we've had to work towards using electronic prescribing as a method of trying to be able to provide the services. And doing that has, in my opinion, definitely improved patient care and safety overall. It's allowed for effective monitoring of the medication. It's allowed, me to be able to communicate effectively with pharmacists to try to be able to take care of things that possibly would have taken days or weeks in the past, and we can do pretty instantaneously. So I think it's definitely been a benefit, and we want to make sure we move more people towards trying to look at this effective advancement and trying to be able to prescribe medicines as well as controlled substances, in this way to try to be able to help us. And in each of the places I've done it before, I've done it in a couple of different places. Yes, we have to go through the extensive process of gaining access to it. You have to go through the identity proofing. You have to go through the, all those things that get you to the point of being able to do it. But once it's done and once you complete those steps, it by far, I think helps with efficiency and eliminates a lot of other hurdles that are there for us and that cause, some of the challenges that we have, and most importantly, it improves patient care and safety overall.
Well, thank you so much. That's wonderful information. Mr. Jackson, Mr. Whittemore mentioned how successful we have been here in Florida in getting pharmacists to actually set up their systems to accept electronic prescriptions. And so if you could share with us a little bit about how that has, you've been able to help in making that happen, as well as share with us kind of what you think the future is for e-prescribing from the pharmacist perspective.
Well, thank you very much, and good morning, participants, and thank you for joining us today on this very important subject matter. In pharmacy, we've been using computer-based applications for a long time, and I've been around long enough to see that this was something that's been growing within our industry for the past 35 years. I was practicing pharmacy when we didn't have computer-based applications, and in adding on to what Dr. Williams was saying, I remember the first day when they plopped a computer on our desk in our pharmacies. It was a device that we were very apprehensive over. We just didn't trust it. We didn't know what it was going to do. We didn't quite understand the technology behind it. And quite frankly, it took a while to adapt to it. We are now at the point now where it's difficult to even run and manage and operate a pharmacy without a viable computer-based application system. Over the years, what we've also learned in the use of our computer-based application is that we can use that tool to transmit information to insurance plans about patients' prescription medications. It reduced a tremendous amount of paperwork that we had to do and created more accuracy in claims adjudication and administration. So it was something that was very easily adaptable within pharmacy to take on electronic prescriptions that come into our systems. It also created a level of efficiencies that we didn't have before. We no longer had to manually insert prescription records into our pharmacy dispensing systems because that information had begun arriving in pharmacies electronically. So with that and looking at the prescribing of controlled substances electronically, in Florida, we lagged here a little bit as a result of some interpretations of our state laws. Our state laws were fairly vague when it comes to whether or not the prescribing of Schedule II controlled substances was permissible electronically. And so we had repeated meetings with our state's regulatory board to explain what the issue was and what we thought that they needed to do in terms of interpreting how Florida laws are in this area. And our board made a determination that the electronic prescribing of Schedule II controlled substance prescriptions is permissible in this state. And with that, that opened up a pathway or doorway for a standard electronic prescribing of prescriptions, Schedule 3, 4, and 5 prescriptions, and Schedule 2 prescriptions using the same platform. And so that helped to close that gap. Now we have more physician providers that are now seeing opportunities to do that. There are a number of advantages that we see with electronic prescribing, and that as I attend our state's Board of Pharmacy meetings, typically you might see several cases dealing with a medication error or prescription misfill. And some of these errors may be related to translation errors of a written prescription that a pharmacy receives. Well, when I attend Board of Pharmacy meetings these days, I no longer see those kinds of errors anymore because what is prescribed is what arrives in the pharmacy. So we are actively promoting and advocating for this technology to continue. There are growing pains, especially when you're integrating physician pharmacy practices and pharmacy systems. And there are a number of hiccups that we see, a lot of things that we struggled with when we first started using computer-based applications in pharmacy. We learned how to overcome those issues. And I think my physician colleagues out there are beginning to experience what we had to struggle with back in the 70s and 80s. And I have high confidence that they will overcome some of the challenges that we ran into. We would certainly welcome an opportunity to serve as resources to our physician colleagues and to connect in better so that we can offer a much safer processing system.
Awesome. Wonderful information from all of you. I just so that we can set some I guess leveling or grounding, just in case there are people out there that don't know a lot about e-prescribing, and I'll open this up to whoever jumps in first, and if nobody jumps in, I'll pick a name. But Michael, you did mention regulations around e-prescribing. Are there different regulations around e-prescribing versus paper prescribing?
Yes, there are some unique differences, but not a lot. Everything that needs to go into a paper prescription should go into electronic prescription. However, there are certain circumstances where there's a need to print a prescription record in a physician's office. There are specific guidances that the Drug Enforcement Administration provides when electing to print a prescription in the physician's office. So if you for example, if you electronically prescribe, for example, a controlled substance in a physician's office, and then there's an interest in printing a prescription afterwards, I think the guidance from the Drug Enforcement Administration suggests that because the prescription has already been transmitted to the pharmacy, that a printed prescription should be noted as void or invalid for purposes of dispensing, so that you don't have two of the same prescription records out there creating possible duplicate therapy for patients. There are times when there may be some noise in the network that an electronic prescription may not be able to transmit appropriately or properly, and the need for the physician to issue a printed prescription is there, so that option is available. It's just that there needs to be a process in place to notify the pharmacy where the prescription was supposed to have been sent to, that did it arrive, and did it not arrive, where is it in the process? And in some cases, just like all electronic transmissions of information and data, it's dependent upon the networks that process that information. We have seen situations where patients were actually sitting in the physician's office and an electronic prescription is transmitted right there in a patient care area, and only to find out that the prescription took over 20 minutes to arrive in the pharmacy, because sometimes that electronic transmission is not instantaneous like it normally is. There are occasions when there's a slowdown in the process, and it could be a bottleneck in the way electronic data is transmitted through networks.
Okay, and so you talked a little bit about transmissions, and so Mr. Whittemore, how would a physician know if a pharmacy is enabled to accept an e-prescription, and then vice versa, or even how do physicians know if their systems are set up to e-prescribe?
Well, Dr. Williams might want to chime in on this a little bit, but I can speak to one of the issues. Is in an EHR, there is a directory of pharmacies that a physician can choose, from among those pharmacies, the pharmacy of the patient's choice. If a pharmacy doesn't appear in that directory, then they are not able to receive electronic prescriptions. So it's pretty straightforward. Those directories get pushed out pretty much on a daily basis to EHR systems. The EHR systems may not update them in the end user applications quite that frequently, but they should be pretty much up to date. But that's basically how a prescriber would know. that a pharmacy would be able to receive a prescription. And similarly, if they wanted to send a controlled substance prescription to a pharmacy that wasn't able to receive it, that should be clear within the EHR, clearly designated within the EHR. But again, I think Dr. Williams probably has a perspective as well.
Yeah, and that's pretty much been, my experience in the different EHRs and systems that I've had the experience in working with. Generally, as you're in an EHR or if you're in a separate electronic prescribing program, generally whatever pharmacies show up in the directory there, or whatever you search, are the ones that you're going to be capable of being able to e-prescribe to. And specifically as it relates to the controlled substance, there's usually some delineation or some identification, whether it's a red C or something that stands out to let you know whether or not a pharmacy can receive controlled substances. And if you attempt to send controlled substances to a pharmacy that doesn't receive it, it will not allow you to do that. So typically the lists are there, and they whether it either blacks it out or doesn't allow you to proceed, there are sort of safeguards that allow against doing something that's not available, and it also clearly tells us which ones it can be sent to. And I do just want to add on to what Mr. Jackson says, just to note that it is our experience also that if a prescription is sent electronically and then it's attempted to be printed, it definitely does. If you print it, it definitely says there specifically that it cannot be used. It's a duplicate that's been printed only for printing purposes. So I think there are a lot of safeguards in there to try to be able to help us with that, help us to try to be able to make this an efficient process and try to decrease any type of duplication of problems there.
I've gotten a lot of questions from our audience, so I want to get some of these questions in. And one of them is something that Mr. Whittemore and I had emailed back and forth about a little bit, and that is the ability for e-prescribing systems to allow for bidirectional communication now. And so the question actually is, how is bidirectional communication handled between pharmacies and providers? And so, Mr. Whittemore, I don't know if you want to start the conversation, and maybe Dr. Williams and Mr. Jackson can add into that.
Mm-hmm. Sure. So, obviously, we've already covered the primary transaction, which is the provider sending an electronic prescription to a pharmacy. But since the inception of e-prescribing as we know it, it's also been possible for pharmacies to send refill renewal requests back to providers. So if a patient runs out of medication that they need more in order to dispense it, the pharmacy needs authorization from the prescriber. Previously, in the days when, and I think I've been in practice as long as Michael has, probably a tad longer, we had to pick up the phone typically and call the physician or their practice and get authorization to dispense more of that prescription. This can be done electronically and very frequently is done electronically these days. So again, that's been basically part of the process from the beginning. But of late, over the past couple of years, a couple of newer transactions these have been available from a standard standpoint for a while, but the industry has started to adopt them. One is known as an RX change, and this is a message that can go from the pharmacy, can be sent from the pharmacy to the provider, asking for a change in a prescription. It might be because of formulary issues, therapeutic issues, prior authorization. There's a number of use cases that that particular transaction is useful for. And then on the other side, something that we're hearing more and more from providers about is the ability to cancel a transaction, to send a message to the pharmacy saying, I do not want the patient to receive this medication any longer. That can be used both in the instance where somebody's been on therapy for some time and the physician's just decided to make a change, or it might be that they sent a prescription through and after they hit the enter key, they said, oh, I didn't mean to do it quite that way. And so they would send out a cancel and indicate that please cancel this. I'm going to follow up with a new one. But so that's That's what I would have to contribute in terms of the transactions available.
Yeah, I'd add on that, you know, all the ways that have been discussed in terms of communication, I think are pretty much in line with what we've been doing historically and the gradual progression of that. For myself, in the different systems I've used, there will be oftentimes where you may be able to send messages over if cancellations or changes need to happen. Some of the systems have, you know, that worked in. It's a little easier to do than others, but generally there is a way to try to be able to communicate that. Of course, if there's something immediate that needs to happen and we're not sure about transmission times, you know, picking up the phone and talking with the pharmacist is a way to try to be able to resolve issues as well. And oftentimes they may see medications come through electronically, and if we need to cancel or change something, we can make sure we take care of that. Another thing that I think may be emerging overall, and I don't know how many of these systems have this, but you know, in many workplaces, there are these instant messaging systems that exist that allow for communication back and forth pretty quickly among individuals. I know one of the systems I use has, well, I don't use the messaging system, but I know they have a messaging system. I think in the one called Dr. First, they have a messaging system that is supposed to be a secure, HIPAA-compliant messaging system that allows for instant messaging between, I think, the pharmacy, the providers, and even the patients as well. So that may be, in the day and age in which we live, I don't know whether or not that may become more of the norm in terms of ability to be able to communicate pretty instantly on what some of those questions and situations need to be.
Mr. Jackson, you want to add in there?
No, I think that it was pretty much covered. There are just a lot of advantages to being able to have electronic dialogue back and forth between healthcare provider groups. Our society today is a digital society, and if you don't believe me, try to have a conversation with your kids. They're more apt to respond to you through text messaging than a phone call. So this ability to be able to communicate back and forth electronically is going to be the standard of care, I think, in the future. Plus, it provides a level of accuracy that maybe we would have a telephone conversation with a healthcare provider, and what we hear and what we note in our records may be different. And the electronic prescribing and electronic messaging helps to clear a lot of the foggy areas that we run into with communications about patients' health information. So we see this process as maturing with time, and we think that it will grow with experience.
Great. A little bit ago, we talked a little bit about the security of the systems. That we do have a question about contingencies that what contingencies are in place if electronic systems go down for whatever reason, if there's a hurricane or something happens. Are there contingencies in place for pharmacies, pharmacists, and for providers to handle those situations? I'm going to start with you, Mr. Jackson.
Yes, and disaster planning is part of every manual in every pharmacy, and having to deal with that, especially here in Florida, since we are vulnerable to weather conditions and other things that might cause systems to go down. Obviously, when we're faced with this scenario, pharmacies are still able to continue providing services to patients. There are actually regulations here in the state that allow us to do certain kinds of things that we can't do when the governor declares a state of emergency. So if we can't communicate or connect electronically, many of our pharmacies have backup operational systems where we can still do the things that we need to do. And if we have to rely upon the old methods, such as a telephone call, we will do that. But whatever it is we do is we do have backup systems in place. And so when the systems do come online, then that information would be available and shared.
Mr. Whittemore or Dr. Williams, do you want to add to that?
Well, I agree that, you know, disaster planning is very important at all levels. And, you know, even at times with my own practice, when we've had issues because of stores that haven't had access to the electronic means. I guess we have to always keep a small stash of paper of our old paper products around in the event that they have to be used, the worst case scenario. But that's not something that we have to rely on too much. But we do have that, if necessary. But most times there are those safeguards in place for any types of major issues that may occur, and we've been able to get through them successfully. And it's never been, I don't think it's ever lasted too long to put a significant dent in our operational procedures overall.
Okay. We have another question, and this is from the pharmacist's perspective. What is the board status on receiving electronic controlled prescriptions from other states?
Okay. Electronic prescribing from other states. So if you have a physician prescriber that's issued an electronic prescription to a pharmacy in this state for a regular legend drug or a controlled substance, can they be filled? The answer is absolutely yes. So long as the prescription meets the criteria that's in Florida law. So for example, if a prescriber is issuing something to a patient and arrives in the pharmacy electronically, and since we do have a lot of out-of-state patients who may come to Florida for vacation or visiting family or friends, and they're away from their prescriber, they will issue electronic prescription. We can fill it so long as the prescription is used to treat a chronic or reoccurring illness. And then it would be up to the pharmacist to make sure all the other elements that are required in the prescription are there. So if it's an out-of-state physician and it's an electronic prescription and everything else is valid, as a pharmacist, you can fill it.
Okay, awesome.
So if I could, sorry, just like to chime in, just to level set. E-prescribing, both for non-controlled and controlled substances, is legal in all states now. That wasn't the case, excuse me, several years ago, but that is the case now.
Okay.
So with that, let me just I guess say, I guess as that for myself, having being licensed in a couple different states, I know that it definitely is I guess beneficial to be able to prescribe some medication, in particular controlled substances is what I'm speaking about. Oftentimes in different states, but oftentimes different states have their different regulations, and oftentimes I have to be licensed in a state or seeing a patient in that particular state and states outside of Florida in order to send some controlled prescriptions to them. And sometimes that may be sort of specific to the state and the type of medications, but I think overall it is allowed across the board and across the state for all of them. But for me and for specific medications, I think with children, I do have to have a license in that particular state and a patient in that state for a few of them.
Okay, yeah, that's a very good distinction, Dr. Williams, that you need to make sure you understand the laws and rules in each of the states in which you are prescribing. And a couple of more questions. This one is to you, Mr. Whittemore. It says, how frequently are the new transactions, the prescription change that you mentioned a little bit earlier, the percentage of scripts that are changed or canceled? I think she's referring to if you have a change in a prescription and you cancel those electronically.
Well, she might be referring to the change and cancel transaction that I mentioned.
Yeah.
And also, as I mentioned, those are, in terms of usage, pretty new. And so the volume of transactions that we're seeing is quite low at this point. So it's hard to derive any statistics or learnings from them thus far, because again, we're still trying to get these out into the field. Basically, in a way, we're going through what we went through 15, 16 years ago when we got started with e-prescribing. As in order for a pharmacy to send a change transaction, their vendor has to do some work in terms of coding, and the physician's EHRs have to do some work to, they have to upgrade their systems and add that functionality, and that takes time. There are I think 60 plus pharmacy vendors still out there these days. There are literally hundreds of EHR companies out there in the marketplace. So kind of, I hate to use the phrase, but it's kind of like herding cats, getting everybody on board and making them see that providing this functionality to their end users is going to be valuable. So we're still in the stage of trying to get everybody on board.
Okay. Another question, and very interesting question. What issues do you face from insurance companies in terms of e-prescribing?
And this is Michael Jackson. I can address a couple of things that we run into. One of the things that I think that pharmacists struggle with, and it's not something that you see all the time, but it pops up every now and then. But we'll have a situation, for example, a prescriber may elect to print the prescription rather than electronically prescribe it, because maybe the prescriber may not be sure where the patient's going, or the prescriber is in an emergency room and issuing the prescription to a patient, and the patient will then bring the electronically printed prescription to the pharmacy. And in some cases, the software will generate what is known as a digital signature on that prescription. And for regular legend drugs, there's probably a way we can work through that. In pharmacy, for controlled drugs, that creates a problem for us, because essentially what will happen is, especially with third-party plans, when they come in and they audit the records of a pharmacy, they're going to want to pull copies of prescriptions that are in the record. And if they see that a prescription arrived that was hand carried in by the patient that had a digital signature on the prescription, in some cases we've seen situations where the auditors would disallow the prescription for purposes of payment. So with that, if the electronic prescribing system or the EHR system is used to generate a prescription, it's usually a good idea for that prescription to have a hand signature, a wet signature on it before it's issued to the patient, so as to prevent any recoupment of claims that the pharmacy is transmitting to the patient's insurance health plan.
Okay. Dr. Williams, do you want to?
As far as from my experience, what has been helpful, and I think another significant benefit of using e-prescribing is, oftentimes whenever e-prescribing systems are embedded into EHRs, or those that are, maybe used independently, the patient's information and demographics are populated into those particular systems. And along with that, obviously their insurance benefits and different things are also included in some of these systems. And what that does and how it helps us, and another, again, like I said, benefit of this is that oftentimes when you go and attempt to prescribe medications, we'll see what we're able to choose, which formula, we're able to choose which medication can be prescribed. And we also sometimes get coupon savings opportunities that come up for individuals that you can be able to click on. So I think it's been helpful, and I think it only can improve just across the board the communication that can be beneficial for us. And just as Mr. Jackson has mentioned before, moving in the direction of this being the norm, I think helps overall with all the levels of communication. So the insurance and its ability to be able to let us know what can and can't be prescribed, I think can help to eliminate a lot of hurdles that sometimes we've dealt with over time in getting medications cleared and the proper medications for the patients.
Wow, so it's been actually a benefit for them. Another question. This one is for Mr. Whittemore. It says, while Surescripts is mainly for prescribing medication, is there potential for prescribing medical supplies in the future?
This question has come up from time to time. My sense is that right now that's not going to happen in the foreseeable future. I wouldn't say never, but I don't know of any current plans that we would address that at this point.
Okay. We do have a question about transferring EPCS prescriptions. If a prescription has been sent from a doctor's office to a pharmacy and then a patient goes to a different pharmacy, is there a way for that prescription to be transferred to the other pharmacy, or are there any prohibitions on that? I'm going to give that to Mr. Jackson.
Yes, absolutely. There is a process in place to allow for that. And does that occur? Yes, it probably occurs quite frequently, especially when you have a community that might have a particular chain and there's a selection of one of the chains pharmacy on Main Street, but the patient actually goes to the sister pharmacy on Adams Street, for example. So it's not uncommon for the need to reroute prescriptions that are transmitted electronically. A lot of it involves reaching out and communicating with the physician and the pharmacy to, first of all, let the physician know you routed an electronic prescription to pharmacy A. I am pharmacy B. The patient wants to have her prescriptions filled here. So you might want to update your records to show where that prescription went. And also at the same time, the pharmacy that received the prescription has to reach out to the other pharmacy to make sure that that prescription had not been processed and filled and waiting on the patient to pick it up. Because what that pharmacy will run into is an attempt to try to, for example, bill the patient's health plan. And the health plan will say the prescription had already been filled and is not allowed for new filling. So there is a process for that, and actually there's a resource on the Drug Enforcement Administration's website that has a very exhaustive list of frequently asked questions on what to do when certain scenarios arise. And the frequently asked questions section can answer a lot of questions that come up on a regular basis. Okay.
So if I could, let me just quickly supplement Michael's answer, I should say. Everything he said is accurate. Within a chain, yes, you can now you can transfer these prescriptions using because they have a common database. There is, however, an enhancement to the ePrescribing, electronic ePrescribing standard that will allow such transactions to go back and forth between pharmacies that aren't under common ownership. That functionality probably won't be available for another year and a half, but that is coming.
Wonderful. We do have, we are getting close to our time, so I am going to just ask one final question, and I'll allow each of you to respond to it. And it's really kind of a double question, but what do you think are the benefits of e-prescribing, and what can we do in Florida to help increase the use of e-prescribing? So I'm going to start with Mr. Jackson.
Oh, absolutely. I am a proponent of electronic prescribing. I really believe that it is a safer system. It is a way for the errors associated with transcription to be removed out of the equation. There are a few growing pains associated with it, but it is my presumption, it might be a presumption as it is, but it's my presumption that the handwritten prescription as we know it today will be something that you'll see in a museum 10 or 15 years from now. We do believe that the electronic prescribing, that once you get connected in there and see how it works, see how it helps to populate our pharmacy patient records, and how it creates the enhanced ability for pharmacies and prescribers to connect with each other, is going to do nothing but improve patient care and patient quality. So it is, there are some growing pains that are ahead of us, but to me, it just makes sense. It just seems to work better once all the kinks are worked out, and we know that's going to happen.
Wonderful, thank you. Dr. Williams?
Yes, I without question, I definitely agree with many of the things that Mr. Jackson mentioned. And from the provider standpoint, I just definitely think that the benefits and the impact it can have on healthcare, as we said, it can improve patient care and safety. It reduces the medical errors. It has the electronic safeguards and checks and balances in there, of course. It reduces all the issues with the handwritten prescriptions that have existed over time. In my opinion, it's more convenient. It reduces the paperwork. It allows for monitoring of medication history. And one of the things we didn't touch on much, but hopefully gets integrated into a lot of these systems, is the prescription monitoring programs that a lot of states have that allow us to go back and view prescriptions that have been filled by either doctors or other providers. So it allows us to really see that information. I think it builds stronger relationships between the physician and the pharmacy and even the patient. And I think, it helps us combat, in my opinion, fraud and prescription abuse and, a number of different things. And it decreases a lot of delays that we have had in the past. So I do think that there's significant benefits for it. We are moving in that direction as a society and as it relates to just taking care of business, and healthcare is within that realm as well. And we want to be as efficient as we possibly can. And I think to try to encourage more of it in Florida, I think we want to gradually move towards doing that and urging providers to do that. I don't agree with necessarily taking away anyone's autonomy on how their styles of practice, but if the arrow is pointing that direction of primary electronic communication and transmission of information, that's what should be encouraged. And I think we have to also put maybe some incentives in place, just as incentives were put in place for providers to move towards electronic records altogether. And then, eventually move in that, maybe a similar approach can be taken, there, maybe some agencies, the HR platforms, insurance employers, might have to begin to strongly have some associated requirements for electronic prescribing, with their contracts and agreements and everything. But and I think, most importantly, if the statistics are able, because us being statistical people, if statistics are able to show an increase in patient safety, improvement in the overall delivery of the healthcare, and the streaming of the workflow and everything, and we can enhance and improve communication and clarity, and we can decrease the misuse of prescription drugs, I think it will encourage others to be open-minded about the change. And in my mind, hopefully that can help us move towards that date when we're doing more of that and less of the other.
Wonderful, wonderful insights and thoughts. Thank you, Dr. Williams. Mr. Whittemore.
It's going to be very hard for me to improve on what these two gentlemen have just shared. They've covered the landscape, but what I will say is that we obviously agree with all of those descriptions of the benefits, and we're looking toward expanding the scope of what can be done in terms of electronic communications among providers, pharmacists, and others in the healthcare field in order to continue to provide actionable intelligence at the point of care. In terms of trying to move it forward in Florida, I think it basically has got a lot to do with education. I think programs like this are going to be helpful in getting folks to understand, again, the benefits, and then also, if they're interested in becoming electronically enabled, how to do so.
Wonderful. Well, I want to thank you again. You have been wonderful, wonderful panelists, and we appreciate you taking time out of your busy day to help us understand what's going on with e-prescribing in Florida. I think we probably could have gone for another hour, but we will, just for those in the audience, there will be a recording of this so that people that missed it in your organizations can actually listen to this conversation and get a little bit better understanding of what's going on in Florida with e-prescribing and what can be done to help in increase in utilization of e-prescribing. I do on your screen right now have some contacts and resources for you if you're interested in those. And again, this will be part of that recording. Again, thank you, gentlemen, for being part of the conversation and part of the solution in Florida related to e-prescribing. We really appreciate you, and have a wonderful day. And for all of you in the audience, have a wonderful day as well. Thank you so much.
You're welcome.
Yep.